everybody, Lori Broccolini here. Talking about hocks in horses, equines. So a lot of conservative treatments works well for many hock sprains in horses. So this is from the horse, and researchers in Europe do pretty well after injuries, and they return to work with proper rest. They use a lot of the treatment is stall rest, return to work, and 6 months injury for a hock. So they want to be able to diagnose any lesions in the ultrasound and x-rays before they decide that it's a hock injury. It usually is joints, bones, soft tissue is a lot of it. And so these ligaments are two parts: long superficial components, short deep components. Ligaments provide stability in the hock and during stance and movement. Tension occurs in the hock extended weight bearing, whereas the hock's flexion when lifting the limb creates tension on the short components. So when they sprain them, there's trauma. Those sprains occasionally occur through repetitive strain, just as like jumping, barrel racing, horse racing, jumping mostly, eventing. So we used to use magnet boots on our horses before we went out on the event field, and jumpers and dressage too. So they did a controlled study, and they did a lot of stall rest. All the horses in the study did exams, and only one of the ligaments affected, bringing a total number closer to 108, total of 111 lesions. So there's a lot of lesions in there. So ultrasound increased the fluid, and that's caused by the lesions. So fluid builds up, and it's just protecting the lesions, the tendons, and everything else in there, the ligaments. So a lot of stall rest, hand walking, and these horses received anti-inflammatories, probably like Bute and whatever else they have on the market, which I'm not up to date on because I don't do drugs. So to do this, so what happens is the synovial fluid still stays in there. It's very easy to get out, but with vets, they don't use it. So a lot of them, 12 of the horses had to be euthanized out of the 111. And so a lot of ultrasound, a lot of money, a lot of money, a lot of money. So what do we do? Okay, well, what causes it? Not having your horses properly shoed. I learned a long time ago to give, I learned that every 8 weeks, no later than 9 in the wintertime, 10, the latest, that you let your horse go without getting trimmed. I don't do shoes, so they're racing now without shoes. So anyways, so muscle pain, which is also in the hock, is very debilitating. And it's like it says, the fluid goes through. So when the feet aren't right, too much. So the vet was here. Now this woman and I, she's no longer here. She's passed on. She's a good friend of mine. And we did have a big fight about this. And she said I was absolutely right, that her horse was having hock issues. And he was only 9 years old. And I told her that he doesn't have any kind of arthritis back there because his feet were way too long. He had too much toe. And so that puts a lot of strain on the back of the hock. So she agreed with me. So she went ahead and balanced them, and next thing you know, her horse was better. So the first thing you want to do is diagnose it, and they say to stall rest. I say, no, maybe stall rest for a couple days, hose it down, make sure you hose it down, and give it the homeopathics. So you want to you want to hose it down, and you want to put liniments on it. I used my deep tissue. Homeopathics, Apis for sure will get that fluid out. Rust tox and rust tox, and follow the natural diet, like the Big Sky diet. Learn stress point therapy and do the stress points on your horse, which is in my book. It shows you the picture of the horse and where the stress points are. And the liniments, it doesn't matter. Just get a good liniment and put it on there. Don't wrap it. So, and then after a week, just put him in a small paddock. Let him decide. If for pain, if you want to use bute, I can't tell you not to use bute. But, I mean, if he's in severe pain, yeah, use bute. But I wouldn't do that. I would just use probably a half a bute in the beginning, and then make sure there's no infection in there with it, you know, with the joint and the hock. Have your vet make sure. You can have an ultrasound done. Massage is good. So you want to walk him, and you want to keep him on black oil sunflower seeds. The deep tissue oil repairs muscle, ligaments, and cartilage. And you can buy this at Dr. Christopher's or through me. I don't have any right now. It's back ordered. So you want to give black oil sunflower seeds, and it would take a lot of black oil sunflower seeds to be toxic. A lot of people worry about that, but I wouldn't worry about it, because what happens is the horse will not eat it. They'll turn it away, which is fine. That's okay. You don't have to worry about that. So the next thing you want to do is you want to get the wand. The iTerracare wand. This is a testimonial on this lady's 3 horses. And you can see him, a cute little donkey, little Nar. And she had all kinds of issues. And she got the wand. So 3 or 4, she wanted them every day for the past 3 weeks for, except for 4 days, family stuff, whatever. And I used my pendulum to determine the energy work. Patty had a left CI joint and back leg issues, which are hocks. Wanting 10 minutes each time has shown an increased extension in the gait smoother. Dempsey in the middle is an Arabian. He has issues that brought him 10 years ago, and the chiro came to adjust it, and way his pole and hip and right shoulder were out. Adjustments gave him temporary results, but nothing, you know, spectacular. So he did not canter because I didn't want to canter. Her daughter outgrew her horse, so Dempsey would not pick up the right lead. Her daughter started riding him. So she started wanting him in the areas, working around only the saddle, the shoulder, the front leg, and he picks up his right lead consistently without even thinking about it. And he doesn't toss his head during transitions, and she only watches them for 10-12 minutes a day, and she does a really, really good job. And so he's doing well. So then she has this mule that is the biggest success. It was abused, and 17 years ago, very hard to catch, hard to play games with, hated men, including my husband, who feeds him every day, tolerates me fly spraying, brushing. Well, it was a nightmare to do vet visits and farriers, and the last 3 weeks we went from that to this. He will walk to his food bucket, wait for my husband, put the feed in a bucket versus standing a distance away. I can approach him, and he will stand and allow me to cuddle. I can halter him without any bribes or captures. He can let me lead him. The biggest success was yesterday when the gentleman came to float his teeth. His body language was scared and was ready for a big chase to capture. He allowed the guy to touch him, pet him, lead him, and do his teeth, and didn't have hardly any pullback. And it's like unbelievable what this wand has done with these horses. So, I mean, there's your testimonial there. So you want to do the homeopathics at the same time, get on Big Sky Minerals, get off the commercial feed, and please don't feed beet pulp because it ties up their muscles and the calcium inside of their system. Okay, I hope that helps. HappyNaturalHorse.com, Natural Equine Remedies. Have a great day. Share and leave a comment.